again and again. Okay, see. So the first thing we need to understand lipid profile test. Lipid profile test means it is also one type of blood test where we are founding as well as we are measuring the lipid and allied things related to the lipid. See, we are measuring the abnormalities in lipids such as cholesterol, triglyceride into the broad level. Understood? So that whenever we are measuring the cholesterol, we are measuring the triglyceride, we can easily measure if any kinds of cardiovascular disease or cardiovascular risks are present or not. Okay, that's all are things related to the lipid profile. After that, what is the purpose of lipid profile test? See, detect any kinds of lipid abnormalities. I am again saying you one thing that and that is hard, right? That is hard. That is hard, right? That is hard. There is a right atrium, left atrium, left ventricle, but there is a circulation within the whole body. They require the vein or artery, right? So that there is a aorta is always present, right? Aorta, and there is a superior vena cava and inferior vena cava is present. So that they require the blood vessels. If any kinds of fat deposition are happening into the particular blood vessel, then which kind of problem might be occur? The problem should be occurred like that the blood will not flow properly within the particular vessel. Understood? So that whenever the blood are not flowing properly, blood will not come properly into heart, as well as circulation or blood circulation into the heart will not occur properly. That is called cardiovascular disorder, as well as that is called cardiovascular disease. Understood? Anyone want to say anything? Okay. Okay, that's all are the cardiovascular disease. Okay, we have to measure this thing. Second thing, you need to understand, monitor the effectiveness of lipid lowering treatment. Means when we are taking the treatment, when the lipid level is low, we have to take in some kinds of drug which will elevate our lipid level, right? So that we have to evaluate the particular treatment are occurring properly or not. Understood? And that's also same like the cardiovascular reducing system as well as treatment plan related to the cardiovascular risk. Understood? Now I am coming to the parameter. Parameter means which kinds of component basically present into the lipid profile test we need to understand. Keep in mind that lipid mean there should be present the cholesterol, there should be present the triglyceride, and if you are noticing the cholesterol, see, if you are noticing the cholesterol, CHO cholesterol, see, there is basically three type of cholesterol. One is HDL cholesterol, right? High density lipoprotein. Another one is LDL, low density lipoprotein, right? And another one is the VLDL, that is very low density lipoprotein. Understood? Here, the density of lipoprotein is high. Here is a density of lipoprotein is low. Here is a density of lipoprotein is very low. Understood? So that we have to measure the cholesterol, total cholesterol, as well as HDL, as well as LDL and VLDL. We can easily calculate from that cholesterol minus we have to sum up HDL and LDL. Understood? And another thing you have to measure, that is the triglyceride. Triglyceride is also one type of lipid. This triglyceride basically providing the energy when your body are not giving the particular energy to doing any kinds of action, then triglyceride will give you the particular energy to doing the actions properly. Understood? That is the triglyceride. Okay, that's all are the thing we need to measure. Understood? Okay, after that, if you are noticing here, that's all are the parameter. Okay, and HDL is called good cholesterol, LDL is called bad cholesterol, triglyceride is basically found into the blood, VLDL is also measured, right? That's all are the thing as well as that's all are the parameter related to lipid profile test. Understood? Now I am coming to the normal ranges and I am saying you that how to you find out these things as well as how to you doing the test. I have already explained every manual procedure, right? As well as I am saying you that nowadays manual procedure are not uses. Nowadays, basically, s- they are uses the automated machine. So that into the panel of the particular automated machine, you have to just choose the particular disease. Sorry, parameter. Okay, or you have to choose direct lipid profile test. Okay, lipid profile test, you have to just choose lipid profile test and just click here and you will get automatically result. Understood? Because nowadays the whole phenomena are happening into the automated, so that you can take the advantage to the particular phenomena. Okay, and you have to just put in the particular sample how much amount that might be 150 microliter or that might be 200 microliter. You have to just measure the sample and you have to just provide the particular sample to the machines. Okay, and machine will give you the particular result. Understood? That's all are the things related to the that's all are the thing related to the lipid profile test. Okay, say me, anyone have any kinds of doubt? Anyone facing any doubt up to this much? Anyone have any doubt up to this much?
No, sir.
Okay, everyone understood the thing, though the things is really too much easy for all of you. See, because I have already covered the parameter, right? See, now I am discussing with you the normal ranges. Normal ranges means which kinds of ranges are basically founded into the lipid profile test. I have already discussed the whole thing into the manual procedure, though that is a little sum of the whole parameter. You have to just notice here there is a normal ranges mentioned into the particular PDF. See, notice here total cholesterol less than 200 milligram per dl. Okay, that is the total cholesterol. After that, HDL or high density lipoprotein cholesterol 40 to 60 mg per dl. Okay. After that, LDL cholesterol or low density lipoprotein cholesterol, see, less than 100 mg per dl. Okay, less than 100. That is the LDL. After that, triglyceride, that is a less than 150. Understood? Less than 150. That is a triglyceride. After that, VLDL, that is a very low density lipoprotein cholesterol, that is a 2 to 30 mg per dl. Okay, that's all are the normal ranges you might found into the lipid profile test. Okay, after that, clinical significance. See here, the clinical significance, if you are noticing here, see, whenever if any kinds of cholesterol level or lipid level become higher, then you might found the clinical significance or disease related to the cholesterol. Okay, see that high total cholesterol, that's basically increase the risk of heart disease, because whenever the cholesterol level high, they basically form the plaque formation. Plaque formation are happening. Plaque formation are happening into the particular vessels. Okay, plaque formation are happening into the particular vessels. Then you have to just think one thing that whenever the plaque formation are happening, then blood flow are not occurring properly and blood are not flowing properly. That is the disorder or issues. Okay, so that whenever the blood are not flowing properly into the heart, then heart related problem might be. See, after that, that is a HDL. After that, low LDL, HDL. Low HDL means, see, when you were the HDL level is low because HDL is a high density lipoprotein, right? So that high HDL is a very good, but low HDL it's bad because see that is the whenever low HDL are basically present, there should be present the high level of LDL and high level of VLDL. Understood? That's the beneficial whenever the HDL is high, but it's are harmful when it's low because high density lipoprotein can easily move and easily transport through the blood vessel. They are not forming any kinds of plaque. Okay, they are not forming any kinds of plaque. Okay, okay, but whenever the their level is low, then they can form the plaque formation. After that, high LDL cholesterol, understood, that basically it increase the cardiovascular disease. After that, high triglyceride associated with the increase the risk of heart disease and pancreatitis. Okay, whenever the triglyceride level is high, then there might be the condition of high heart related disorder. Okay, as well as there should be disorder related to the pancreatitis or pancreas inflammation basically happening. Okay, after that high HDL cholesterol, that is a plaque formation are happening. Sorry, VLDL cholesterol plaque formation. I have already told you that. That's all are the thing related to the lipid profile test. That's all are the lifestyle you might changes. Healthy diet, regular exercise, weight management, limit alcohol, avoid smoking, this kind of things you might do. Okay. See, after that normal ranges, I have already told you that significance. I have already told you that that is the normal report of lipid profile test. Okay. Here I am not mentioning the name as well as who have done the report. Just think here that is also one pathological laboratory report. See, that is a cholesterol level, there is a normal ranges or reference ranges, there is a unit and there is a particular result. That's all thing are normal if you are noticing here. See, total cholesterol, after the triglyceride level, after the HDL level, HDL cholesterol, after the LDL cholesterol, after the VLDL cholesterol, after the non-HDL cholesterol, that's all are the things are measured into the lipid profile test. Though the test is really too much easy, you have to just look down upon the things. And I have already discussed the basic as well as minimum thing related to the whole separate parameter. Okay. Say me, anyone have any doubt? Because the class is too much shorter because I have already covered the whole thing separately. So that whenever I am sum upping the whole things, it takes less time, very less time. Okay, it takes very less time. Whenever I'm just sum upping the things because I have already covered the whole things properly. Okay, just say me. Anyone have any doubt?
ক্যালকুলেশনটা কাইন্ডলি একবার বলো।
Which calculation?
এইচডিএল এলডিএল আর ভিএলডিএল এর
Understand. Three level of calculation.